We have all of the written policies and procedures that meet OSHA's regulations, and we actually write all of it up for our offices, so everything is completed based on our training and everything as well. So we also provide the training that's needed too, and we provide CEs as well.
Hey everyone, welcome to the Dental Office Managers Community Podcast, where we talk about the issues that matter most and help us to become better leaders in our dental practice. I'm your host, Kyle Summerford. Let's dive right in. Hey guys, it's Kyle Summerford here, and we are on for another session for our podcast for the Dental Office Managers community. And today we have with us Joyce Weeks of Continuing Ed?
Dental Ed.
Dental Ed.
Yes,
Sorry,
I
said I was not going to say that, and then I turned around and said it.
That's
so the
fine.
name of your company is?
Dental Ed Inc.
Dental Ed Inc.
Yes.
Dental Ed Inc.
That's right.
Got it. Okay,
Yes.
I got it. They got it. We got it.
No worries.
Okay, so Joyce.
Yeah.
It's a pleasure to have you on here today.
Thank you so much for
I
having me
appreciate
today.
you taking the time out to jump on here with our office manager community.
Yes.
And, I wanted you maybe just to share a little bit about yourself and how you ended up in dental.
Okay, yeah. So I actually started teaching in dental offices about 9 years ago. My background is actually in infectious disease. So I have a degree in biology, and then I have a master's in immunology and global health. I'm originally from San Diego, California. I grew up there. So when I finished my master's, I moved back to San Diego and was looking to teach about infectious disease. My mom had owns this company, and she suggested that I come and basically just go around with her and teach about bloodborne pathogens so I can get some teaching experience. And I was planning to apply for a fellowship with the CDC. And I ended up, really enjoying going into offices and getting to meet different people every day and
Cool.
be a part of the community. It was really cool. And I love talking about infectious disease, which I know, pre-COVID, nobody really talked too much about.
Yeah.
But in the dental space, we do, of course, especially bloodborne pathogens.
Yeah.
And then a little over a year ago, my mom retired, so I took over the company.
Okay, cool.
Yeah.
So you said San Diego.
That's correct.
Okay, so I've been to San Diego once.
Okay.
And I'll share a little story with you,
Mm-hmm.
right? So I went to San Diego, and I went for a dental meeting.
Yeah.
And I was actually doing a hands-on workshop, but I was speaking about the financial side of dentistry.
Okay.
And so I ended up finding out that there's like an area there in San Diego where they have a bunch of sea lions.
Yes.
Okay. La Jolla, I think it was called.
Yeah.
All right. So I went there by myself, jumped in a taxi, went there, and I went down to the steps to the beach.
Uh-huh.
And I said, you know what? I'm just going to walk up to these guys and just pet them. That didn't work out very well.
No.
Yeah. So they turn around, they start chasing me back up the stairs.
Yeah.
And it was pretty scary. But San Diego was a pretty cool town. So I've been there once, and that's pretty cool that you're from there.
That's so random that you mentioned that, because that's actually where my husband proposed to me.
Oh, get out
Yeah,
of here.
it was
really?
when the seals, the sea lions were having their pups. So
Yeah.
there was like all the pups were right there.
Oh, wow.
Yeah, so overlooking that, like
that's
that
so
area,
cool.
La Jolla Cove.
Yeah, I went down there. I was like, let me walk up to these guys, and they weren't having it. They were like, what are you doing here? And
Yeah, get away.
yeah, I'm thinking like they're like, cats or dogs. We
Right.
could just walk up and pet them, and they're
Yeah.
gonna be friendly, like, but it didn't work out that
No,
way. So,
yeah.
so that was
And they're huge.
Oh yeah.
Yeah, they're massive.
Yeah, I didn't realize how you from above. I mean, it wasn't that high off from beach level, but still, when I went down there, I was like, wow, this guy could probably eat me, because I'm like 5 feet tall, with she's on maybe 5'2". So it was like a little scary, but
They're pretty large.
yeah. So that's
Oh,
cool.
That's so funny.
So the company specializes in what? What exactly do you
So
specialize
we
in?
specialize in OSHA and OSHA training, infection control. I also, since I'm based in California, we provide the Dental Practice Act, so like the mandatory courses that are needed for license renewal.
Okay.
So regulatory compliance is what I say. I don't do HIPAA, but we do everything else. So we have requirements for our health department, dental board, and OSHA is what I do.
Oh, wow.
And we write up all the protocols, policies, and procedures. I help with all of that stuff. So I do everything for our office when we work with them.
Gotcha.
And we provide CEs, of course, as well.
CE for the doctor.
No, for everybody.
Oh, for everyone?
Yeah.
Oh, wow.
Yeah. So in
Okay.
California, we have hygienists and assistants also need CEs.
Okay.
We do have like unlicensed dental assistants as well in California, but they still have certain courses that they have to take to work in the office.
Really?
Yeah.
Huh.
Mm-hmm.
Yeah, so I'm in New York City. So
Yeah.
this is news to me.
Yeah.
I may not retain it all because
That's okay.
I'm not the expert.
You don't need to keep it in your brain.
But that's interesting. So certain states have certain requirements
they do.
and CE regulations. Huh. So California is one of those states.
Yeah, California is actually the strictest state in the U.S., or at least it's certainly up there. And I know San Diego is the strictest county in California, or one of the strictest counties.
Wow.
Yeah, so we have a lot of requirements out there.
Huh. Interesting. So in terms of like training, is this like in-person training, or is it like a virtual training? Like what type of training is it?
So I offer both.
Okay.
It depends on kind of what the office prefers. Obviously, for clients that are near me, in person is pretty easy to provide if they want that. For offices that are outside of San Diego, then it's a little bit trickier to coordinate, but it's certainly possible, and we have done that in the past as well. And then if an office wants to work with us, but we're not local, then we just are able to send information to them. We can send the paperwork or whatever is necessary to get them in compliance. And I do work with any other state. So what's interesting about OSHA is there's federal OSHA, and then there's also some states that have state OSHA requirements as well. So there's can be specific requirements depending on which state that person or office is located.
So each state may fall. Okay, so correct me if I'm wrong.
Sure.
But from what I understand, there's federal OSHA.
Yes.
And then there's state OSHA.
For some states.
Yeah,
because of course they have to make it complicated.
Of course, it can't be easy, and I'm sure.
Which is why I have a job, right?
Exactly. Yeah, and you'll be in business for a long time. Because,
yeah.
Because the more money the states need and the government, the longer you'll be in business. So
exactly.
That's a good thing. Right?
Yeah.
So in terms of federal and state, what is the difference? Are there a lot of differences, like the requirements? I guess it's hard because it's state by state, right?
It is state by state.
Okay.
So usually the rule of thumb is if you have state OSHA, it's going to be stricter.
I see.
There'll be more requirements. So with California, we follow what we call Cal OSHA. So California OSHA. So their regulations are going to be more specific than state OSHA, or than federal, pardon me.
Got it.
So for example, in California, we just had a new regulation that was passed just this past September, where we now have to have a workplace violence prevention plan. And that's going to be enforced by Cal OSHA.
Wow.
And it's added to part of their injury and illness prevention plan that's already being enforced by OSHA. This is just another aspect to it. So we can either add that prevention plan as a part of the injury and illness prevention plan, or have it be its own separate plan, if you will.
So violence in the workplace.
Violence in the workplace.
Uh-oh.
I know.
Violence in the workplace. So what are some of the crazy things that are going on with violence in the workplace? Could you share one with us?
Yeah. So in the process of creating this new course that we have coming out relatively soon, I've actually heard several things. I know that there's in San Diego, so near where I live, it's actually in El Cajon, California, and some of you may have already heard about this. There was a dentist, I believe he was 29, who was fatally shot actually by a patient, which was just awful.
Wow.
And I read about dentists who were stabbed. There's been, of course, a lot of domestic violence stuff. There's a lot of
stuff
issues
going on.
Yeah, and it's not just in dentistry. We're seeing it kind of across all workplaces, which is why this particular regulation applies to all workplaces. Previously in California, we have had a requirement for healthcare in general, not just in general, pardon me, like hospitals and all of that. There was a requirement for workplace violence prevention training, but there wasn't one that encompassed dentistry until now.
Wow.
Yeah.
Wow. So what would a workplace violence plan kind of look like? So
it's going to need to be incorporated by the office where they receive training by somebody that is knowledgeable on the subject. And then they also have like protocols in place on how to, respond to different potential issues that may happen in the office. So let's say, one would be, of course, like a disgruntled employee, or maybe there's, domestic partner or something like that that's coming into the office, or issues, that maybe the person isn't even coming into the office, but you have an employee that's having problems at home. Or it could just be, one of the things that we're looking at with Amy Wood, who I know you had on the podcast as well, would be, some of the issues with like cybersecurity and hacking and things like that. There can be violence associated with that as well, like bullying and things. So, of course, safety with your employees as far as protecting them and their information from patients is incredibly important. And so I always talk about with a dental board in California, how your license and your address and information is actually public record. So making sure that the address that you have on your license on the Breeze website, so if you're in California, you know what I'm talking about, is not your home address. And also on social media and things like that, to think about using a different name or like a nickname or something like that instead of your actual name for your own protection, which it's hard and sad that we have to think about those kinds of things. But when you do work in a situation where you're in the public it's can be for your own safety, unless you have like a public platform. But it's just one of those things, you could have like a separate account for public versus your private account, and lose protection.
Yeah. What's funny is you mentioned that, and years and years ago, I had actually I had looked up so what the issue was in this practice, right? I had to get the DEA. I think it was the DEA number. I think I needed to send in a verbal prescription.
Gotcha.
After hours for a patient that needed some type of medication. Yeah. So I didn't have the DEA number.
Okay.
I thought it was very interesting that I was able to pull up the DEA number for the doctor by just Googling it at that time. Yeah. Now, I don't know if it's still like that, or maybe that was like a one-time occurrence or something like that.
Yeah.
But I remember, as you're mentioning this, I'm like, privacy and things like that. I was able to pull that up at that time. I don't know, just what you said just kind of struck a chord with me, because I'm like, well, dentist information is out there, right? It's like you are kind of on the web all over the place. I mean, in a way, you're supposed to be. Because you need to expose your business and get more patients. But at the same time, it's like, I feel like that is sensitive information.
It is. It's finding that balance, right?
Yeah.
And that's where, it's so hard to know how much information do you share. And that's, I'm crossing over into Amy's territory.
That's okay. That's all right. It's all good information.
She would know so much more than I do. But that's actually why we decided to collaborate on this, because as I was doing research to create this course, I was like, Amy, I need you to join me on this, because there is such a need for, and I am not a HIPAA person. That is an area that nope, not my background. Infectious disease, I got that, like infection control, OSHA, I can do that. But when it comes to like HIPAA and cybersecurity and AI and all of that, it's outside my wheelhouse. And I am more than happy to admit that. So I definitely will always defer to her on that information. She's by far knows so much more.
Cool.
Yeah.
All right. So, okay, let's do this. Would you be able to share maybe one productive tip with our audience in terms of OSHA? Maybe just staying compliant, maybe just staying on top of things, being aware that, they need to kind of do certain things at certain times to remain compliant.
So I think one of the big things that a lot of offices don't know is about OSHA does require you do annual training, but they also require ongoing training as well. So you do training annually with somebody who understands the required policies and procedures, and that you update your paperwork and all of those protocols that are required, like the injury and illness prevention plan I mentioned. And there's a whole bunch of others that are needed as well. And the workplace violence course is one that's going to be included in that group as well. But they also want you to be to talk about like ongoing safety training, and that's dependent on the number of employees you have. So if you have 10 or less employees, it can be done quarterly, or if it's more than 10 employees, it's supposed to be done monthly. And it can be on anything that's related to safety. There doesn't, some companies will provide, topics. So we do that for our clients, of course. But it also can just be on, like if you're doing CPR together as a team, that meets that requirement. Or if, you get a new X-ray machine and someone shows you how to use it, that meets that requirement. As long as it's related to safety and making sure that you're safe in your work site, you're meeting OSHA's requirements.
Awesome. Okay. All right. Well, thanks for giving us this awesome information.
Yeah.
So your company is able to provide those services
Absolutely.
and cover those aspects.
Yeah, we have all of the written policies and procedures that meet OSHA's regulations, and we actually write all of it up for our offices, so everything is completed based on our training and everything as well. So we also provide the training that's needed too, and we provide CEs as well.
Cool. Awesome.
Yeah.
All right.
Thank you so much.
Joyce, thanks for coming on and sharing a little bit of your wisdom with us. Giving us little tidbits of knowledge. So appreciate you coming on here. And guys, if you're interested, reach out to Joyce Weeks, and she can help you guys out with some OSHA training if your office needs it. And if you don't realize you need it, hopefully you do after this podcast. So guys, take care, and we will talk to you later. Bye.
Thank you. Bye.